Today in Baja Window to the South, we are at the ITC, the Immunity Therapy Center, and I'm here with Dr. David Alvarez, who's going to talk about pain management, something really important in cancer patients. Thank you, doctor, for being here with us. And about the topic, can you please tell us what are some of the typical things that cause cancer patients pain?
In most of the cases, it's sort of a mechanical issue. If a tumor, let's say, is pressing through important structures such as blood vessels or nerve, it can end up causing specific types of pain.
And doctor, what does pain management means for a cancer patient?
So cancer by itself, it's a complex disease that has many symptoms and many signs. One of the most common one would be pain. So it's always a priority.
And why is pain management important before, during, and after cancer treatments?
Well, pain, as I mentioned, since it's one of the most common symptoms that comes along with the disease, in cases could be an indicator of the response of what we're doing. There are different ways that we can evaluate the progress or the result of our treatment. One is through the clinical part that comes with pain, with weight loss, with more appetite, energy, those type of things. In some cases, we evaluate as well through imaging studies, or some forms of cancer would have certain blood markers that can give us an idea. But in this case, it's basically to evaluate if the pain is getting better. It pretty much means that something is happening on the inside.
Okay.
So it could be a response.
I think I understand. And how do you assess a cancer patient's pain?
Well, there are different types of pain, depending on what the diagnosis is. During the initial admission, there's a part of the treatment that will basically ask a lot of questions regarding the diagnosis, the type of pain that patients could describe, the type of medications that they're taking, so we can understand better what the situation is and come up with a specific regimen that can either take care completely of the pain or manage it to a point where we can complement it with other things.
Okay. And how frequently do you assess a cancer patient's pain?
Well, normally we see our patients every day. So there's either a consultation at the office, which is the most common thing, or we go and check with our patients every day. So part of the main things that we ask is, how is your pain doing? How is your appetite? Is the nausea better? Are you feeling with more energy? How's the fatigue? So there's a daily evaluation that we have, and pain is most of the times the main question, right?
Wow, that is great. And what are some ways ITC manage a cancer patient's pain?
Well, there are basically three ways, right? We know the common medications that most of the patients are taking. We have some IVs that can have anti-inflammatory properties, such as curcumin, such as DMSO. There are some functional therapies that can help to alleviate the pain as well, everything that involves heat. Hyperthermia therapies, for example, some types of hyperthermia, besides the impact that it has against the cancer, can generate some pain relief by reducing the inflammation.
You most definitely have a lot of options for your patients, and that's really amazing. And does pain management evolve during the course of a cancer treatments?
Well, the objective is to try to use less and less invasive methods, right, or standard medications. But at the same time, is putting on a scale, and it's so important to evaluate this daily, and it's so important that our patients share with us how they're responding or how the pain is getting better. Otherwise, it might require a higher dose of something, or it might take a little longer for the medication to act. So that's why it's so important, the evaluation, and eventually what we want is to reduce dose of certain medications and try to substitute it with something less standard or more from the functional side.
Yeah, most definitely. And are there ever side effects from the pain management itself?
With some type of standard medications, there's common things such as nausea, constipation, feeling dizzy, insomnia. But what we try is to select the best option for each patient so we can reduce the possibility of a side effect and try to complement that with some of our treatments, with the biomagnetic treatment, which can help a lot with inflammation, with some types of hyperthermia, as I mentioned, and some IVs, like curcumin, for example, which is it's turmeric, it's a natural anti-inflammatory, and it can help a lot with relief, pain relief.
Of course. And is pain ever a good thing for a cancer patient to be experiencing?
Well, here at ITC, in some cases we call the healing pain, let's say. We believe that when our treatments, the medications, or IVs are going where they have to go, it creates a local inflammatory reaction from the tumor itself. So in cases, patients could experience some pain, but it's very different to the traditional type or the normal pain that they would experience.
And please tell me, why is it dangerous for a cancer patient to hide or tolerate their pain?
Well, in some cases, pain could be a symptom that is covering something else, right? I don't know, a bowel obstruction, a fracture, things that could happen with having this diagnosis. So it's always important to share that with your doctor. That's why we try to establish a connection with our patients from day one. But at the same time, if that's not the case and it's just related with the same tumor itself, it might require a high dose of a medication that you're probably trying to avoid, or it might take longer for this to act.
Okay, and why do some cancer patients experience pain, others a little or none at all?
Well, cancer is unique, right? Every patient is different. Even having or sharing the same diagnosis, every cancer behaves in a different form. There are some types of cancer that are known to be more painful, such as pancreatic, bile duct, gallbladder, liver tumors, everything that is that has spread into the bones, such as a metastatic tumor, breast tumor. But there are some other types of cancer, more from hematological disorders, such as a leukemia, that won't give you much pain. So there's an initial evaluation where we pretty much have a good understanding on where we're at, what to expect, and based on that we customize the pain regimen, right, or the pain management.
Thank you so much again, Doctor. Very helpful information. Is pain management included in the ITC cancer treatment plan?
Pain management is a priority for us. Besides the impact that we want to have against this disease, we focus a lot in quality of life. So there are different things that come along with that term. Pain is one of the most common things that comes with the diagnosis. So it's something that we address from day one. Cancer by itself, when you hear the word cancer, your whole world changes, right, completely. So there are several things involved, right? But emotionally it's very hard for patients to deal with this diagnosis, and if on top of that they're dealing with a tremendous amount of pain, it interferes a lot with the healing process and with the will that patients have to keep fighting. So it's something that we focus on controlling from day one. And as I said, there are several options, right, to control this.
Most definitely. Oh, well, thank you so much, Dr. Alvarez, for all this information. Now you have a lot of options here about pain management and ITC, and you're always on top. I love that, and well, I hope to see you again very soon so you can share with us more helpful information for all our audience and people who are in this situation, most definitely. Thank you so much, and this was Baja Window to the South.